Jenna, I like the little sun drawn behind you. I wish it was out in the sky instead of on a
Exactly.
balloon. No.
It's a crap day, so I figured why not bring a little sunshine?
Good morning, everybody. How's everybody doing this morning? A little bit gloomy outside, but it looks like you guys have sun. Some people have some sun coming in their windows. That's awesome. I decided this morning that I'm going to put up this as a picture of me ziplining in Mexico last year. Yay, why not, right? Looks like fun, and there was a lot of sun there, so I'm pretending that that's what's happening behind me right now. Yay, why not? Just a little change from the Disney and Pixar movies. So just a couple of things, and then we'll get started. Today is going to be a short lecture. It would have been a short lecture, honestly, if we were still on campus and doing this. This is a lecture about augmentative and alternative communication. And a lot of this, again, we're getting towards the end of the semester, and many of these things we've talked about, and we're just sort of putting it all together in one sort of lecture for you, specifically focused on AAC. Okay, thank you, Jordan. Grace is struggling with some technical issues. Okay, so a couple of questions that I have for you guys, and you can either chat back or unmute and answer. So next week for lab, I am considering doing, I have some more videos of some things that Devin would have come. He would have been coming for lab next week. And there were some videos and things that he was going to show you. So that would be part of lab next week. I am considering making that asynchronous and posting the videos for you to watch on your own time. And then creating like a discussion forum. What do you guys think? Okay, no.
So if we watched them in class, would we still have the discussion forum, or is the discussion forum going to happen either way?
So if we watch them in class, we would have discussion during class time, like lab time. So creating the discussion forum would sort of replace that in-class discussion. So, and the discussion forum would not be quite as extensive as like the discussion forums maybe you did as assignments, right? For some of those lab assignments, like the adaptive equipment reflections and upper extremity hemiplegia reflection. Again, it would be more to sort of mirror like what the discussion would be like in class. So, you know, a shorter post and replies to a couple people. Okay, I'm getting a couple of agrees. So I will plan on doing that for next week, and I'll send out, you know, specifics about it when I have it all set up. If there is anybody that strongly disagrees and would like to let me know, you can certainly reach out to me, email, you know, via email and that kind of stuff. But I will plan on going forward with that. Very cool. Like I said, I'm, you know, trying to be just really mindful of how much time we spend in front of the computer, and whatever is going on in people's lives, I know is way different than how things were going before. So just trying to make things a little bit more flexible. The other question is, I have been recording all of the lectures. And the reason that I've been doing that is in case somebody like our buddy Grace, who is having issues getting on, you know, for technological issues. So I do have them all. Do you guys want me to post those on Moodle? Like for everybody to have access to them? I can do that. I just have to convert them and put them on YouTube, and then I can post them on Moodle. Or if somebody like maybe Grace today might be looking for a specific lecture because she's having trouble getting on.
I think it'd be a good like study tool to have to be able to go back to each lecture and look at them again.
Okay. Okay. So I will plan on working on that tomorrow. Okay, that's all I got. So I will pull up the PowerPoint for AAC. So last year we did have a speech and language pathologist come in and do a guest lecture here. So she was kind enough to let me use her PowerPoint this year and go through some of the specifics that she would have been talking to you guys about. You guys can see the PowerPoint okay? Okay. So just a quick review. This is, you probably know, you know, a lot about what, or maybe not. I honestly don't know how much you know about what speech and language pathologists do and what their scope of practice is. So this is just a really nice slide to give you sort of the overall sort of scope of practice for SLPs or SLP buddies. So articulation, right? How individuals form words, fluency, their voice, receptive and expressive language. When we get into and talking about swallowing, cognitive aspects, social aspects, and then AAC, there's a huge overlap here between speech and language and occupational therapy. Swallowing, if you are an OT that works on, you know, feeding issues, you would overlap with SLP definitely from the cognitive perspective. So speech and language pathologists, their scope of practice and perspective is language-based cognitive issues, and then language-based social aspects, and then AAC. So there's big overlaps there. We work really closely with our SLP friends in those areas. So overall, what our speech and language pathologists want us to know is the purposes of communication is not just expressing needs and wants, right? There's much more. And if you look in the notes of this PowerPoint, she has a really nice example of each of these. So if you were to go to a restaurant, right? So number one, yes, you want to express your wants and needs. You place your order. Can I have this? I would like that. Information transfer, the example here is you're talking to your friend that you're eating your meal with, and you're telling them a story about something that happened over the weekend. So you're transferring some information to them. Social closeness is a purpose of communication. So an example is you compliment your friend about something when you're having your conversation, right? That creates a social closeness. There's also social etiquette rules, right? And within our society and within our culture. So you greet the waiter, you say, please, thank you. And then also purposes of communication is your own internal dialogue. So the example here is you're having a good time with your friend, but you're also most likely thinking about prioritizing or whatever is going to happen next after you're having that meal. So our SLP friends want to support the people that we work with in all aspects of these purposes of communication. So you might have an individual that you feel can express their needs and wants, but how are they able to use communication for the other aspects and the other purposes? And do they need some support that way? So here's just a review of not all encompassing, but different types of populations and diagnoses that have issues with communication needs. Some of these might seem obvious to you, and some of them might not. So in the notes here, she has ASHA, which is the American Speech and Hearing Association. It's like AOTA to us. ASHA to speech and language pathologists says 2 million plus Americans have complex communication needs, right? And they cannot communicate through traditional means. And just some definitions of things here that you might not know at this point: developmental apraxia of speech. That is difficulty with motor planning. So from an OT standpoint, we work with individuals that have dyspraxia or apraxia because they have issues with motor planning with their body. And people can also have issues with motor planning their oral motor structures, right? And difficulty making the accurate movements that their oral motor structures need to make in order to form, words and say what they want to say. Some examples of disability following a surgery. So example there would be a laryngectomy, right? So somebody could have their larynx removed. That's typically in oncology or a cancer situation. So somebody who could, communicate in traditional means before, but following a laryngectomy, they don't have that voice anymore. And so they would need alternative communication. And then temporary conditions, an example of that is somebody who is intubated. So somebody who is intubated and alert, we still want to be able to make sure that they are able to communicate in some way. Even though we know at some point they'll be extubated and then they'll be able to communicate in traditional means again. Any questions about any of these diagnoses on here? Those make sense to everybody? Great. So this is just her picture of assistive technology. We know all about that. So augmentative and alternative communication, what do those terms mean, right? What is augmentative and what is alternative, and why are they together in this acronym, AAC? So augmentative means that the non-traditional way of communicating supplements existing speech. So somebody who has some speech but needs support or supplements or something added to the speech that they have to help them communicate better. And then alternative communication is in place of existing speech. Okay, so somebody may not be able to verbalize. So this alternative communication or non-traditional way of communicating replaces existing speech. And it's important to know that AAC may be used as temporary or permanent form of communication throughout an individual's lifetime. So it could be from birth and they use it for their whole life. It could happen anytime in somebody's life based on circumstances. And again, it could be temporary or permanent. So 10 things you may not know about AAC. I'm not going to read through all of these. You guys can go back and take a look at these. Sometimes these are, myths or, misunderstandings about AAC. Some of the important things are that AAC supports speech development and language skills. So this is sort of the idea I think we talked about before, especially from a developmental perspective. When there are kiddos that have difficulty with mobility, that we very often, by the time they're 2 or 3 years old, are recommending a wheelchair, a power wheelchair. And parents can be a little resistive to that because they think that that's going to stop their child from walking and stop their ability to develop those skills that they need for crawling, walking, or whatever mobility. When in reality, it supports and builds that mobility and gives that child so much more freedom to explore the world. Right, so same idea with AAC, that it doesn't stop kiddos from developing speech or developing language skills. It actually supports and increases their ability to do that. So, but often same issue happens where parents get a little resistive with a communication device because they think that that's what's going to happen, that it's going to keep their child from developing or make them stop using the voice that they have. So I think I talked about an example, my friend whose son has muscular dystrophy. I talked about his example where she was very resistant to him getting a power wheelchair. And then when we finally were able to sort of talk her into or encourage her to do that, the big change in his mobility and his freedom and his ability to explore his environment that she could see. But she's still extremely resistive to him using an AAC device because of the low tone and the decreased strength in his muscular skills. It's very difficult to understand what he is saying if you're somebody that doesn't interact with him often. But we're still working on an AAC device with her. So you can take a look at the other sort of aspects here about things you may not know about AAC. So different AAC systems, and they are defined by ASHA and SLP by unaided and aided, and then high tech. So unaided AAC systems are no tech. There's no technology involved, and they are part of the person's body, right? Gestures, manual signals, facial expressions, body language, vocalizations, and verbalizations. And these are all things that we all use in our way of communicating, right? We know that body language and facial expressions and gestures hold a lot of meaning when we are communicating with other people. So if somebody is not able to use traditional ways of verbally communicating, then we consider, right, unaided or these no tech ways of communicated as an AAC system for them. So an example, very clear example, I have worked with many individuals who have been in the ICU and then have been intubated with a breathing tube, so they can't communicate. So this is where we go right, the first thing we go to is sort of unaided AAC sort of communication, right? So blink once for yes, twice for no, kind of thing. Or if they are able to move, can they point to, and use different gestures like thumbs up and things like that to at least start to communicate what they need. And then from the aided perspective, so we consider these like low tech type of AAC systems. So pictures, objects, photographs, writing, and communication boards. And again, I've, in my experience, worked with many, many individuals that have used low tech aided AAC systems, all the way from those PECs, right? Those picture exchange systems that you've seen, to communication boards where somebody is either pointing to words that's on the board, or they might be pointing to letters to spell things out. They also might be using a gaze and a gesture with communication boards. So you may have seen movies or situations where somebody was using a communication board where somebody was doing the scanning, pointing through, right? And then the person makes some kind of gesture, a blink or a nod or something when they're choosing the correct word or the correct letter. And I have, used that in the past with patients before. And then, of course, you've seen all the way up to the high-tech speech generating devices. Any questions about the aided or unaided low tech? Does that make sense to everybody? That I think sometimes the no tech, thinking about that as an AA system, might seem a little bit confusing to people, but we do, even though we all use those types of body movements and expressions when we are communicating, we consider it an AAC system when somebody needs to use that as an alternate way of communicating. So from our SLPs, one very important way for them to figure out when they're doing an AAC assessment, the appropriate type of AAC system for somebody, is to understand what type of communicator that person is. And that will help them, figure out this is one way to help them figure out the best AAC device. So we are going to watch a few videos here. They're pretty quick, but just I think the videos give you a really good understanding of each type of communicator. And these are sort of developmentally, laid out developmentally, right? Emergent, context dependent, and then independent. So an emergent communicator can communicate basic needs and wants, but they do need assistance from a communication partner, and they can communicate, a limited number of messages, and they frequently are talking about the present, not necessarily talking about the past or the future. They're talking about what's going on right in front of them. So the goal is to use symbolic communication in familiar context with familiar people. So we'll just sort of watch this video quickly of Andy so you can get a good sort of example of somebody who is an emergent communicator. So here is Andy. Okay.
Things better, please. Thank you. Much better. Hey, what did you want? I want soda. Okay. All right, you got 3 sips, buddy. 1, 2, 3. Thank you. All right, let's talk some more about your day. Did you watch any TV? No TV? No news? Oh, downstairs? What'd you watch downstairs? Barney? Did you watch any Elmo? No. What about the airplane movie? Did you watch any of that? Over there on that TV? Yeah. Is his name Tom?
Okay, I'm going to stop it there. There's a little bit more. They use the Velcro strips with the PECs for a little bit more communication. But who would like to try to tell us all what types of communication that Andy is using? So he's an emergent communicator, right? He can express his wants and needs. He typically talks about the present, but the speech and language pathologist is trying to help him talk about what happened in the past. And most of his messages are sort of, short and basic. So those are the characteristics of emergent communicator. But what types of AAC is Andy using in this example? Right, Molly says unaided and low tech. Right, so who wants to tell me what is the unaided communication that he is using in this example? Yep, he's shaking his head, yes or no, right? There's definitely some definite shaking of his head. What else is he doing? Gestures, he's pointing, right? He's pointing sort of to where the TV was when they were talking about the TV. Manual signs, yep. And he was saying, right? So he was making some vocalizations. He's using facial expressions, right? So all of those things for Andy, we would consider unaided sort of alternative ways for him to communicate. Even though those are the ways that we communicate traditionally, he is using them as an alternative way to communicate because he can't communicate in the traditional way. And then obviously the low tech is the picture exchange. And it's very clear and it's very structured, I should say, right? So they have the choices of the pictures that he can pick from, and then he needs to take those choices and put them on the Velcro strip because they're stringing together the message that he wants to say. And then he must take the strip off of it and give it to the person that he wants to communicate with, right? So it's very clear, right, what he wants to communicate and who he's trying to communicate with. And then he goes and points through the pictures and the speech therapist says the words for him. Okay. Any questions about Andy? Awesome. Okay, so the next type of communication would be context dependent communicator. So this person would have some literacy skills, so they would be able to read some words. Their communication tends to depend on the environment, the topic, or the partner. They can understand concrete symbols and maybe some abstract symbols, and they can begin to combine symbols to create new messages, right? So you're trying to expand their ability to communicate about a variety of topics and people, but using sort of basic novel sentences and narratives and conversations, right? So this is sort of the next step for communication development from the speech and language perspective. So we will watch this kiddo here. And this is a kiddo that is reading a book with the SLP, and they are using augmentative communication while reading the book. I'll just share it with you.
All right, so today we're gonna read the Icky Sticky Frog, but I kind of tricked you.
Can you guys hear it
There's
okay?
no words in it today. So you're gonna have to tell me what's happening. What's happening with the frog? Frog sees the fly. You're right. What do you think's gonna happen next? What happened? The frog ate the fly. Good job. And here, the frog sees, you're right, the beetle. And what's the beetle gonna do? The beetle's gonna get eaten by the frog. Very nice. What's up next? Frog sees the grasshopper. And the grasshopper gets eaten by a fly. The grasshopper gets eaten by a frog. You're right, sorry. All right, now.
Okay, again, there's more. They continue and finish the story. But again, what type of AAC are they using to read the book?
Low tech.
Yes. Yep. Low tech, aided, right? So they're using a picture system that's a communication board with different pictures. It's a very specific communication board for that story, right? So it has the pictures that are in that story. She's covered the words in the story, so it's obviously a story that he knows and that they've read. And so she is helping to build his literacy skills, not necessarily reading the words that are on the page, but understanding the story and the storyline, like the comprehension of the story, and using the communication board for him to tell her, yeah, I know the frog ate the fly, and then the frog ate, right? And she's also teaching him how to use it at the same time. So you can see all of those things happening. And then the last one is the independent communicator. So this would be the highest level of communication. And so at this level, somebody would have, we would expect average sort of receptive language skills, which means their ability to understand what somebody is saying to them. They're socially engaged. They could most likely write and spell their name around the same time that their peers could. They can combine single words, create novel messages about a variety of topics, and the goal is full independence in using AAC to be able to communicate all those purposes that we talked about in the beginning. Needs and wants, social closeness, etiquette, information transfer, all that kind of stuff. And so we'll just watch Maya quickly. And you can see how she is demonstrates that she's an independent communicator. Okay, there's Maya.
One more question. Last one for real. Clear it out.
Oops.
Full sentences.
How do you use another one?
Tell me after school tomorrow. Tomorrow's Tuesday. After school tomorrow, what do you want to do? You can plan your dream afternoon. What would you want to do tomorrow after school?
Play.
Uh, and what else?
And play with that bunny song. Play with you, Mom.
Play with that bunnies and play with you, Mom. Aw, thanks, bunny. High five me.
Could you guys hear it okay? Okay. It was a little low on my computer, so I just want to make sure you guys could hear it. So what type of AAC is Maya using?
High tech.
Yeah, right. So she's a high-tech speech generating device. She's using a tablet. I don't know if you noticed when she opened, that one page, the communication page, how many choices of symbols that she had on there. I mean, in this instance, she went to the keyboard and she typed out what she wanted to say. But if you had a quick look there, that the images, the symbols were very small. There was a high number of symbols on there, so she clearly can sort of cognitively, manage and understand all the symbols and a high number of symbols and how to use the information on there. But you can also see that she can, spell the words that she wants to spell. She can form a sentence in written in a written way to create that sentence for her mom. And she's talking about the future and she's adding things together with a little bit of help and a little prompting from her mom. But we would consider Maya at the independent communication level or independent communicator. And so her goal would be to get to the point where she can communicate independently using that device. Okay, any questions about those stages of communication and the different types of AAC and how it supports different types of communication? Okay, back to the PowerPoint. Okay, so from the perspective of speech and language, they look at an AAC assessment from primary components, secondary, and tertiary components. So the first thing they look at, the primary components are the symbols and the vocabulary that performs the function of the natural language. And then the secondary components are like the selection method or the output. And we talked about that in the beginning of the semester, right? How the user selects, what they want to select, and that relates to the way that they interact with the system. And then the tertiary is the external components, the switches, the mounts, the training, the support, how portable it is, all things that we talked about before in the beginning of the semester when we talked about users' inputs and control interfaces and things like that. But this is how SLP structures their AAC assessment. So just a reminder, we were talking about the role of OT in AAC assessment, right? We go back to the sensory component, and she has vision here, but we also think about the tactile parts of things and the auditory, right? The auditory response and, the auditory feedback. We certainly think about the physical and motor perspective. How are they going to physically be able to interact with that AAC, whether it's pointing, whether it's gesturing, whether it's a touch screen, whether it's a switch access, and where the positioning needs to be. So this is where she talks a little bit about the symbol type. And if you remember when we go back and we talked about this before, from our perspective, right, when we assess what type of symbol, so the type meaning, is it a completely concrete picture on there? So you look at this picture here and you know that it means cat, right? Very concrete. They're readily guessable is what she says here. This middle one is they're not necessarily readily guessable. You might, it is just one picture. It's not really, but it's not totally clear what that picture means. And then the final one here is when it's really more of an abstract idea, right? So where on this continuum with the person that you're working with, what type of symbol would best suit them? And then we know about the symbol size, right? For a visual component, how big do they need it to be for them to be able to see it and recognize it? And also from a motor standpoint, how big does it need to be for them to be able to point to it or touch it or, right, somehow choose that symbol. And then the field size, right? How many choices are on there and how is it organized? And these, are areas where we would be working with the SLP and trying to figure out from our perspective, from the sensory needs and the motor needs, and then from, you know, combining the language needs from the speech therapist. These are just some other examples of different types of visual scene displays that are different from maybe things that you've seen before. So you can have different visual scene displays, you know, represent virtual environments, photographs, different types of situations or routines, just beginning, you know, just depending on what it is that you are focusing on with your client. So just an example of something different than maybe you've seen. Okay, so, and then when we talk about AAC intervention from the speech and language perspective, right, it is to improve functional communication in their language, their production of speech. And we know, and we've talked about before, that this allowing individuals to be able to communicate decreases challenging behaviors. Oftentimes, challenging behaviors are a result because somebody is trying to communicate something and they are unable to. And then, of course, the social aspect. And our role, even in AAC intervention, because remember, AAC is not where you just give somebody a device or you know, pictures and, you know, then they're able to use it, right? There has to be training and learning, and, you know, people that are in Thursday lab will take a look at today, but, you know, prompting and modeling and shaping and that kind of stuff. And we are still involved in that as OTs and as individuals, especially if you're working with kiddos, as their circumstances change, as they move through the developmental process, right? They're, you know, we're always sort of looking at modifying and meeting their needs the best that we can. So we continue to look at all of these aspects, you know, through AAC intervention. And as things change in that person's life, you know, maybe their seating needs to change, maybe their positioning needs to change, maybe they have a new wheelchair, and then we have to figure out on this new wheelchair how their AAC device, you know, can work. Or maybe something else changes. And again, temporary versus permanent type of thing. So that is all I have for you guys for today. For AAC, like I said, it should feel like a bit of a review of things that we've already talked about, but again, it's just sort of focusing it very specifically for you from the perspective of augmentative and alternative communication. I think some of the new information might be the types of communicators and maybe the types of AA systems here. Yeah, so does anybody have any questions about any of the stuff that was presented today? Stop share so I can see everybody better. Okay, so Thursday lab, so we ended early lecture. Does everybody want to start lab at 10:30? Does that work for everybody? We all just sort of want to meet at 10:30 for lab for Thursday lab. Sounds good. I'll see you guys there. Tuesday peeps, have a great rest of your day and good weekend, and I'll see you next week. Bye guys.